have to spend more time on some misinformation, some scams, people getting their hopes up, thinking there's going to be some type of stimulus check. I got social media out there. There's also information about not getting a check at all. They're going to be ending checks effective September. So we're going to talk about that. There's about 500,000 people that are still getting a paper check. So we're going to talk about how that might affect you and what if you actually do need a paper check. If something happens to you and you need something immediately, what can you do? I'll talk about all of that today. This is also a live Q&A. Looks like I already got a bunch of questions lined up. I've got about 3 video questions that people sent in. So we will get to as many as we humanly possibly can within the next hour. Okay, so what are we talking about here? This goes on all the time. Social media people out there love talking about stimulus checks, what the possibility is. If there's a 1% possibility of a stimulus check, then people will talk about it on a daily basis. Okay, what's the update on the stimulus check? What's the update on the stimulus check? And the update is there's no update. It's like the one about the Doge dividend. That supposedly if they're going to, cut all these programs and save all this money, they're going to give us a part of that money back. And, that was social media hysteria. That's not going to happen. So don't wait for the Doge dividend. It's not going to happen. If there is a stimulus check that is going out, an actual stimulus check that is going out, that's been going out for decades, and that's called the Alaska. Was it called the Alaska Permanent Fund? So that's where these social bloggers and people out there get their ideas that okay, there's a benefit going out, $1,700, and I've got one of the web pages here, one of the articles. So this is in the Sun. New round of $1,700 permanent, in quotes, stimulus checks to automatically hit accounts in just days, no strings attached. And that's basically the Alaska Permanent Fund. And I guess they're kind of socialists up there in the sense of there's natural resources, a lot of gas and oil and all that kind of good stuff, natural gas and oil. And these residents of Alaska kind of get a percentage of it. Natural resources. Go figure that. If we would have done here that in the lower 49 or 48, could you imagine we would get quite a bit of money every single month, every single year if we did the same thing as Alaska. And it's interesting that Lisa Murkowski up there decided to vote against that same type of thing, and for the rest of the 49 states, she voted for the big beautiful bill to cut people's Medicaid and food stamps, and then inevitably our Medicare as well. But anyway, so that's not going to happen. And social media people out there, please stop this. Because when you perpetuate this BS, these rumors, number one, you're getting people's hopes up, and they ain't going to get it. And so why do that? Number two, people start calling the Social Security Administration, asking about where their check is. I ran the third business Social Security office. I know people are tired of it, but there's a lot of new viewers that come every time, so I have to tell who I am. And we used to, every time something like that used to go on the internet, people used to come into our office and we'd have to sit there for the entire day or week and explain to all these thousands of people over the phone and in the office, no, it's not. It's just a social media myth. No, you're not getting a stimulus check. And that would delay everything for everybody else. So people that were there to file for disability, for, surviving child, surviving spouse benefits, all of them would be delayed because of some social media person out there trying to get clicks. So stop it. Okay. All right. What about paper checks? Are paper checks going to be ending? Yes. So Social Security made the decision, Department of Treasury together, that says no more paper checks. So we're looking at about 500,000 people receive paper checks. And what can you do? You have 3 options. You can go and get a direct deposit. You can get what's called a direct express card. It's kind of like they give you like a debit card, and they put your Social Security benefits on there, and you can go get money and pay stuff from there. Or you can actually request a waiver. So there's an actual form, request for payment of federal benefits by check, and you actually have to submit this to the Department of Treasury and say, hey, for whatever reason, I just can't, I don't have a bank near me. I just need cash. I need a, paper check. So there are exceptions for that. I haven't heard anybody, that should be interesting in September when it comes around and see who actually applies for that type of exception. Through my personal experience, doing this a few million times, if at all possible, avoid getting. Let me say this so these people don't call me up. Try to get a bank account, your own bank account. That's always the easiest. People say, well, I can't get a bank account because I've got bad credit and they won't give me one. Some banks, in the YouTube comments and all that, the TikTok and whatever, the LinkedIn, the Facebook, whatever, put in there if you've had good luck with whatever bank, opening an account, because some banks will let you open an account if it's just for federal benefits. So if you say, hey, I don't want a car loan, I don't want a house loan, I don't want, this or that or the other, all I want is a place to put my Social Security check. And there's some banks out there that will do that for you. That is always the easiest. If you can't do that, then Direct Express. And if you can't do that, then you have to request a waiver to get that check. All right, what about checks themselves? Social Security will still give out checks. This is something a lot of people don't know. If you have, you lost your check or something like that, or direct deposit, it went to the wrong account, and you've got like some type of eviction notice and you need that money immediately, Social Security can, I've done this hundreds of thousands of times, issue a paper check out of the office. They always like to do a direct deposit. So something happens and you need something immediately, it gets rerouted in the wrong place and somebody puts the routing number wrong or something like that. You correct it and they'll push it to where it, gets in 2 or 3 days. But if you really, really, really need a paper check, you have to provide usually an eviction notice or something that your electricity is going to be cut off, and they can actually give you a paper check, a completely different check, not like those, with the Statue of Liberty on it. It's a paper check out of the office that somebody, and I used to have to sign those. So they give it out of the office. And every time you go to the bank with one of those weird checks like that, the bank always calls up and says, is this a real check? And that's why every office provides you a little letter that says, yeah, bank, this is a really strange check. We know it's not your regular Social Security check. It's not fake. Call the district manager, call this number, and they will confirm. So I used to always put my number down there, and the bank would call it, and I'd say, oh yeah, Jim, yeah, oh Bruce Davies, yeah, that's a check. Yeah, we just cut that check and send them down to the bank to cash it. Yes, so that is possible. So if you ever need one of those, that is available for those people that are about to be evicted, but you have to have kind of extenuating circumstance for all that. So. All right, I will keep up on all of the craziness out there, but let's go ahead and get into some actual questions about all things Social Security, retirement, disability, all the rest. Bruce, I want over 62 and can get Charlie's checking account for people over 62 as long as you have them direct deposit your Social Security in the account. Okay, not sure what. All right, Mr. Mears, hello. My mom started getting disability when she was 49. She was born in 1955. I'm 41. I found out 3 years ago I can claim her on my taxes, and I changed my filing status. Okay, I don't do taxes here, so I never worked for the IRS. So I'm gonna keep in my lane, as they say. If you estimate your yearly income too and high spousal support was suspended, when should I apply? Okay, so if you were receiving some type of retirement benefits, spouse benefits, surviving spouse benefits, whatever the case may be in that case, and you're below your full retirement age, yes, Social Security will suspend your benefits if you make over $23,400. If you go over that and you don't tell Social Security, then what happens the following year when Social Security finds out through your employer or the IRS, they will send you a nastygram that says, hey, you said you were going to be under $23,400 and you weren't. You went $10,000 over, so you owe us $5,000. Then you set up some type of payment plan, and I've got all that information on my website, mygovexpert.com. But you don't have to reapply. If your benefits were suspended because of that, you don't reapply. You just call up and do a work report and say, okay, yes, I was making over the 23,400, and I know you suspended my benefits, but starting whenever, I am going to be under 23,400 for the year. You can't do the monthly earnings tests again. You can't say, okay, I was receiving benefits for a year, and then I went over and you suspended my benefits, but now I'm going to be under the monthly earnings test, which is the $1,950. You can't do that. You have to stay under it for the entire year. You have to say, okay, starting this year, I'm going to be under 23,400 because, you know, I was going to be over, but it's July now, and I just lost my job. So it turns out for this year, I'm not going to make $40,000. I'm only going to make $22,000. And so they'll restart your benefits. So you just have to call them and do a work report. I just received my Medicare card. My question is, can I have Medicare and ACA? Technically, yes, but you will lose all of your ACA premium, advanced premium tax credits. You'll lose your cost sharing and all that other kind of stuff. So if you want to pay a whole bunch of money for that, sure, but nobody does. So if you go ahead and you are eligible for Medicare because of you turned 65 or 2 years on disability, then everybody just goes ahead and switches from the Affordable Care Act to Medicare. You technically legally can, you just lose all the costs, premiums and discounts and subsidies from the Affordable Care Act. And it looks like a lot of people are going to lose that anyway. It looks like the Affordable Care Act, there's going to be people that are get their Affordable Care Act bumped up by about 75%. So next year, that's going to hurt a lot of people. And then because of that, you know, people are going to say, I just can't afford it, and they drop out, and insurance is a pooled risk, and you got fewer people in there, or they're sicker, then it's going to cost everybody more money. And so I guess politicians believe that is a beautiful thing, and that's why they called it a beautiful thing. Is drawing a spouse allowed to get 50% of their spouse's full retirement if the drawing spouse waits until they're FRA? Yes, you get 50% of your spouse's or divorced spouse's benefit amount, full benefit amount, the PIA, the primary insurance amount, if you wait until your full retirement age. So why do Alaska get paid? Yeah, exactly. I agree. Yeah. It's been, the Alaska Permanent Fund has been around since what, 1970, 76 or something like that. Yeah. And I think we should get that too. I think we should have an American permanent fund where all land, all natural resources, all the stuff that comes out from underneath the, you know, and airwaves and all that, we all should share it ourselves. Universal basic income, because we're definitely going to need it considering all the AI and all that stuff, people losing, losing their jobs. Did I hear you right? I don't know, we'll see. I can apply for my ex-husband deceased Social Security 50%. No, there's a difference. Even if I have remarried. I was with my first husband for 10 years. Could you refer me to forms or my first step? Okay, doesn't sound like you heard me right. So ex-husband and, okay, so you're talking about surviving spouse benefits. If we're talking about survivor spouse benefits, you can get up to 100%, depending on when you file and when that person filed. Well, 100% of their benefit amount. Even if I remarried, are you currently married? If you're currently married and you were remarried before the age of 60, then no. If you're not, if you were remarried and then divorced and now you're single, then yes. So for surviving spouse benefits, you have to be currently not married unless you got remarried after the age of 60 years old. So, and if that's your case, there is no forms. You just call Social Security and schedule an appointment. And they'll do everything for you. I'm on disability and I'm turning 65 in September. Is it my full retirement age and what do I need to do? No, 65 is not your full retirement age. The only thing 65 denotes nowadays is Medicare. But in the old days, it was 65 year full retirement age. Since 1935, it was 65, but they changed it. And as officially this year, it's now 67 for everybody going forward. But if you're on disability, you don't have to do anything. Well, you don't have to do anything for your money benefits. Once you hit 66 in 10 months or 67 or whatever, for your particular case, then your benefits will automatically switch from disability benefits to regular retirement benefits. But one thing I do recommend people on disability when they turn 65 is, in most states, when you signed up for Medicare, Part A and Part B, and then you also look for a Medicare plan, you may have wanted a Medicare supplement plan, Medigap, one of those plan Gs or Ns or Fs or whatever the case may be, but it wasn't available to you in your state. Most states are like that. But now you're 65, it is available to you. And they can't charge you extra, and they can't deny you for any health issues or anything like that. So maybe you need to check that out. I always recommend, if it's not for you, it's not for you. It doesn't fit within your budget or whatever the case may be. But a Medicare supplement, you don't have prior authorizations, you don't have networks. Your network is America. Any doctor, clinic, hospital that takes Medicare, you're good. So obviously, some people say, no, you're not. This place doesn't have availability. Well, that's just, they take Medicare, they just don't have availability. So people are so sensitive. So if you need help with that, you reach out to Chapter, and they can see and give you your options. And if you're going to stay with a Medicare Advantage plan, then more power to you. But at least you check out your options. That's the most important thing in life. Anyone can get a prepaid bank account, checking account? Yes, yes. How do they cash a check without a bank account? Yeah, they're check cashing services all over the place. So let's see. Yeah, someone says Walmart cashes checks. So yes, yeah. Well, yeah. Once you get the check, it's not really a big deal. People definitely don't have an issue cashing it. But I know those check cashing places charge you a phenomenal amount, and it's always kind of hurts because you've got someone that is, can't set up a bank account. All they're living on is Social Security, and then they get, some outrageous check cashing fee. So it's always hurts. Oh, one thing I was going to show you on to know about the whether something. Let me answer this. I hear about viewers who've gotten silver membership here. I would like to do this, but can't see how to do this viewing with an iPad on YouTube. Can anyone help? Yeah, I think YouTube has something down there where you can sponsor and stuff. But that's awesome. But if you can go onto my website too and throw a couple of bucks, some coffee money, that'd be appreciated. My son and I would appreciate it. But here's stimulus money. I've got a foolproof way to show that you can figure out whether it's true. So if you ever listen to social media and stuff like that, about stimulus checks, there's a foolproof way to figure out whether it's real. And that's it right there. As soon as you see that, because anytime a president gives out money, they're going to, pat themselves on the back, and they're going to come up. So if you see the president in front of a podium, back of a podium, in front of flags, and they will say, I'm so awesome, patting themselves on the back. I am going to give you a stimulus check of $1,000, $1,500, $2,000 because I'm so awesome. I know President Trump, the last time, he delayed a lot of checks because he wanted to make sure his signature, usually the Department of Treasury signs it, but he wanted his signature to be on the check. So, but that's the foolproof way. If you don't see that, it ain't coming. So there's that. From single to head of household, now she is 70 years old. I know her SSDI turned into retirement when she reached her full retirement age. How are the changes to Social Security Trump is doing will affect her and my Social Security? Well, it's going to affect everybody's Social Security because we've got this looming. The only 90 checks. So this is July of 2025. So we've only got 90 checks left, 90 more months before the 23% cut. And we've known about this cut, that it's coming. We've known about it for 40 years. We've been talking about it for 40 years, and we've been doing nothing for 40 years. Particularly our politicians have done nothing for 40 years because we haven't made them, because we've been distracted with, conspiracy theories and all the rest of it. So that's how it's going to affect you. So I'm working on a program to see if what we can do to influence that. So, But anyway, yeah, 70 years old, she's receiving just regular old retirement benefits now. She's no longer receiving SSDI. So if she is able to work a little bit and, Social Security doesn't care, she can work all the money, earn all the money she wants. Doesn't affect her Social Security, retirement, disability. She's not on disability. She doesn't have those CDRs anymore, the continuing disability reviews. So you don't, make sure she doesn't stress about that. But if you are receiving the Medicare Savings Program, that's where the state is paying for your Part B, the $185. A lot of people are going to lose that. If she's receiving Medicaid, a lot of people are going to lose that. Every time those work requirements were instituted in states, in Georgia and Arkansas and different places, anytime they tried that, people were cut off that weren't supposed to be cut off because the hoops to prove stuff, it's just very, very difficult to jump those hoops perfectly, and people lose their benefits, and that's been proven. And now we're doing it on a national scale, and according to the politicians, that is a beautiful thing, that you do not have health care. Well, you don't have health insurance. You're still going to have health care. You're just going to go to the emergency room. It's going to cost everybody more money, but I guess that is a beautiful thing as well, according to our politicians. On SSDI, can I get a lump sum or a loan? I heard over 65 can. You're on SSDI, you can do whatever you want in that respect. Work, you're obviously limited in terms of working while receiving disability benefits. But yeah, if you win $1 billion in a lottery, you can still keep your SSDI, because SSDI is not a means tested system. You can have $1 billion in the bank, get $1 billion inheritance, whatever you want. So, but if you start working and making that $1 billion, then no more. Vegas Scott, can you talk about if you want to collect disability, but live outside the country, and if you need to be in country for a period of time when you first file? No, you can file disability anywhere, but it might cause a little issue if they want to see you. If they don't have enough medical records, sometimes they do what's called a consultative exam, a CE, by a Social Security contracted doctor. And I've never heard of a Social Security contracted doctor being outside the United States, except for maybe like on a military base or something like that. No, not an issue at all. So if you are eligible for you're U.S. citizen, a green card holder, and all that kind of good stuff, then yep, you can file anywhere. Just can't receive benefits in North Korea or Cuba. So if you were intending on enjoying the beaches of North Korea, then if I collect at age 62, will they automatically deduct the Medicare Part B premium? Yes, at 65. So I wish it was 62. If I had my way, as soon as you started collecting your benefits, whether it's, retirement at 62 or survivor benefits at 60, I think Medicare should start automatically, if you want it. I don't have that say. So if you start your benefits, retirement, survivor benefits, spouse benefits, whatever the case may be, before you hit the age 65, and you're on benefits, then when you hit 65, about 100 days before you reach 65, they will sign you up for Medicare Part A, Part B automatically. And you can decline Part B if you don't want to pay the $185, but you have to have creditable coverage. That is, you have to have current health insurance from work, yours or your spouse's, have to have at least 20 or more employees in the group health plan, and it has to be through current work. And then, later, once you stop receiving that health insurance, then you can sign up at a later time. But if you don't, then there's a penalty, 10% for every 12 months you did it. I received a notice. My widow's benefits were stopped as of June 2025, 100% until November 2025. Can Social Security keep 100% of my benefits? I tried making arrangements to deduct a percentage, and no. Okay, that is the whole Doge thing that they came in, and they're still in control of Social Security. Doge is still in control of Social Security, but they came in and they said, if you have an overpayment, they changed it from 10% to 100% on March 27th. And then everybody in the country went crazy about that 100% withholding. And then the next month they changed it to 50%. Not okay. So if you go onto my website there, mygovexpert.com, you click on the more, and it has overpayments, and then it tells you the policy there. But no, if they withheld 100%, that sounds like you got that overpayment between March 27th and April 25th, when that was the policy for a few days, basically the Doge policy. But now the policy is 50%. But you can always request a repayment. So you can pay it in full, request a waiver, appeal the decision, request a lower benefit amount. So you go to my website there, and it explains in relatively easy English, better than SSA. Better than SSA.gov. I would argue, easier to understand. But you go in there, and yes, you can request a lower payment amount, and you can. It should be very easy to get up to 60 months, and there's no interest on it. I know they've been talking about adding interest and stuff like that, but hopefully Doge doesn't do anything dumb like that. But anyway, anyone else having the video pause when ads come up on then not resume happening to me for 4 days? I have to go to my YouTube history folder and restart from there. Yeah, no, I haven't. Yeah, let me know if something like that happens. I appreciate it. Am I entitled to my husband's Social Security after his death? It really depends. So if it was a divorce type situation, you had to be married 10 years. If you were married to the person when they passed, you had to be married to the person for at least 9 months. And it really depends on, you can start survivor benefits as early as 60 years old, or 50 to 59 if you're disabled. And then, it really depends on the benefit amount. You can start survivor benefits first and then delay your retirement benefits on your own record, or start your retirement benefits on your own record and delay your benefits on your surviving spouse record until you hit your full retirement age. Bunch of options. So, all right, I've got some video questions here. Let me go ahead and get into, I got 3 video questions that people sent in.
Hello, Dr. Ed. I was just wondering if you could address the hundreds of thousands of expats living outside the country that must fill in Form 7162, some every year, some every other year. But I know of nobody in Thailand that has received one yet. Usually they're mailed out in May of every year, except for the 2 years during COVID time. Thank you very much, because we haven't heard anything. And of course, our benefit units is in Manila, and I guess they don't know. But the form gets sent out to us once a year here in Thailand. We fill it out and send it back to Wilkes-Barre, Pennsylvania. Thank you very much.
Okay, so that's a system that Social Security, Department of Treasury set up, that if you are receiving benefits and something happens, if you live in the United States, then Social Security, Department of Treasury has a deal with the states, the funeral homes, coroner's office, all those places, that if something happens to you, they will notify Social Security and the Department of Treasury, and then your check will stop. If you get a final check, Department of Treasury yanks it out of your bank if you get it, if you're not supposed to have that final check. But if you're living overseas, there is no deal with overseas, with other countries. So what they do is they send a form. It's basically, hey, you still out there form, still alive and kicking form, and you have to fill it out. Sometimes they do it every year, every 2 years, or whatever the case may be. But the Social Security has to know, number one, that you are overseas. So when you file for Social Security benefits, anybody, you give Social Security 2 addresses, or they have 2 addresses. They have your mail-in address and your residence address. So some people, for whatever reason, they keep their residence address, their home, their permanent home, their sister's home, brother's home, or something like that, and then they do the mailing address the same way. They use the same address for the mailing address, or they do like a virtual post office or something. So if you do that, then Social Security doesn't know you're overseas. So then you're not going to get a letter because they don't know you're overseas. So there's a lot of people that never get those "Are you alive?" because they don't know. But if they just changed the law or the regulation about several months ago now, it's basically you can do those over the phone now. So if you're paranoid about getting your benefits and you say, hey, I was supposed to get this form about this time, and mail in Thailand or Portugal or Panama or whatever. It's not great, and therefore I probably didn't get it, and I don't want my benefits to be stopped. There was someone on social media that just had that issue. I think a person was in Thailand or the Philippines, and they had that issue that, hey, they stopped my check, and it just turns out the guy never received a letter. But you can call the 800 number now, and they can do a oral attestation, or you can do it through the federal benefits unit. And yes, the federal benefits unit is in Manila for all of Asia. So if you're paranoid about it, just reach out to 800 number and say, hey, I'm still here. Did you send out that letter? Does a workers' comp payout affect your Social Security checks? It depends. If we're talking about Social Security Disability Insurance or SSI, yes. If you're talking retirement benefits, survivor benefits, anything like that, no. So if it's actual a state public disability benefit, workers' comp, then yes, it just might affect your Social Security benefit. And when you filed for disability, that's one of the things they asked you is are you going to be getting any workers' comp or public disability from, the state or the county or the city or something like that, because it will affect your Social Security disability insurance. Yes. And some people say, well, in order to get around the offset, because it is an offset, to get around the offset, they say, well, to get around the ongoing offset, I'll just take a lump sum. Yeah, nice try. It might actually hurt you, because what they do is they look at your mortality and, based on your age, how long they think, based on Social Security demographics, the bean counters do the calc. Okay, if you're 60 years old, you're probably going to live until like 76. And then they say, if you're going to receive workers' comp that entire time, then they divide it by the number of months you looks like you might continue to exist. And then that's how they do that when you take a lump sum. So sometimes people taking a lump sum is, yeah. Stop bullshitting people. You are a Democrat. Okay. All right. So if you could tell me exactly what was BS I said, then let's talk about it. Let's see here. You don't know what you're talking about, bro. Oh, okay. About the Alaska stimulus package not being for everybody, or the fact that they're getting rid of their September checks, no more paper checks. I remember in the it was in 1982. I was in the Marine Corps in El Toro, California. They've since closed that down, and that's when they were switching to direct deposit. They used to have a money truck that would come out, and they would give you your check, and you'd give it back to them, and they'd give you cash out on the other side of the flight line. But then in 1982, they decided to go direct deposit, and it was voluntary. Marine Corps, nothing's voluntary. Once you're volunteer once, you're voluntold for the rest of the time. So it's like, oh yeah, you don't have to sign up for direct deposit, but if you don't, you need to be called on the carpet, which is you need to go see the commanding officer, and you have to stand in front of him and tell them why you don't want direct deposit. So needless to say, 100% direct deposit. So husband turned 65 in April of this year, has been receiving SSDI for years. Will he will automatically switch over to retirement? And if so, when will it happen? It'll happen at full retirement age. So could I ask you a question? Once you get approved, how do they estimate what you're going to receive? It's based on what you paid into Social Security. If we're talking about retirement benefits, it's based on your high 35 years of earnings. And then they take it and do this calculations, average index monthly earnings, and they multiply it to, bin points. So Giovanni, Giovanni's just going crazy here. I'm going to report you are lying to all these people. Okay, all right, report away, go for it. Don't forget to add that spitball incident in third grade. It's part of my permanent record. That's what the principal said. This is going to be a part of your permanent record. Yeah. So it's an automatic change over at FRA. You may get a letter confirming the change, but the checks keep being deposited. Yeah. So, all right. As a new survivor's benefit recipient, I was asked to sign up for ID Me, not a resident citizen. Do I sign up using my former Social Security number or my husband's Social Security number? If you can get into the system, whatever benefits, it's usually under your own Social Security number. So, All right, let me see here. Let's say goodbye to this young man here. All right, goodbye there. Follow up. Do they only do a CE initially, or is that something that could come up again at a later time? I have plenty of medical records just in case. Thank you. Yes. They can do a CE anytime they do a CDR, continuing disability review. If they decide to do a consultative exam at that time during the CDR, yes, they can definitely do it. Usually not on the CDRs, but sometimes they do. Yeah, it really depends. And they don't always do it for the initial disability as well. It's just if for whatever reason the medical records aren't enough, then they will, look into other things. So. All right, let's see. I've got a couple of other video questions. I got somebody here that's a little shy. They didn't show their face.
I'm just applying for SSD at 31, even though I was disabled when I was 19. I worked very little part-time the last 6 years. The question is, am I eligible to apply for SSD based on my parents' income, which is a little bit bigger than mine? Thank you.
You are eligible to apply for anything you think you're eligible for, number one. So all they can say is no. So in your particular case, when you file, if you're disabled, you're unable to work because of a disability, then 100% file for benefits. And then what happens is when you go in there, the Social Security employee, the Title II, or in your case, it's probably the Title 16, Title II of the Title II of the Social Security Act. Title 16 is Title 16 of the Social Security Act. Title II is what I was before I became a manager. That's retirement, Medicare, survivor benefits, SSDI. Title 16 is SSI, Supplemental Security Income. So yeah, they will check out, in your case, three things. They will check for SSDI on your own record, your own work record, and doesn't look, possibly you're not entitled there because you didn't pay in enough for the last, you're not currently insured is what they call it, but they'll check it out. So they will apply for SSDI for you, and you tell them that you became disabled before the age of 22, and they will check into a DAC claim, a disabled adult child benefit claim. And they will also look at a SSI, supplemental security income. So they will take all three of those claims. They better. So when you go in there, call right now, run to the phone right now and schedule an appointment, because time, it's going to take forever anyway. And you want to make sure you get this process started. So you call them up and say, yeah, I want to file. I want to file for SSDI, SSI, and DAC benefits. And they'll say, wow, this person knows what they're talking about. So is this person a plant? So they'll make sure they don't mess you around. So. Anyone possibly able to bless me with a meal on my birthday today? I'm homeless. Oh my gosh, proof on page. Yeah, sorry. I'm working on something like that. So community based. So Kathy, my sister passed away 58. She has special needs, 18-year-old us. There anything that the 18-year-old can do? She cannot work. Thank you. If the person's parent passed away, it should have applied for surviving child benefits. You can get it up to the age 18, before 18, but if you're still in high school, you can continue it up in 19 and 2 months until you graduate high school. But as I just mentioned with the previous video, the child can apply for, this is surviving child's benefits, in terms of also disabled adult child. So if a special needs, you apply for disability benefits on the parent's record. So this is a DAC, disabled adult child, a surviving disabled adult child. So for the previous one that just made the video that I answered, for that type of disabled adult child, well, I think she said her parents might have passed away too. So for survivors, you get up to 75%. If you're just filing for disabled adult child and one of the parent you're filing on is still alive, you get up to 50%. So same thing with you. Get someone needs to help that 18-year-old file for, again, the disabled adult child benefits, surviving disabled adult child benefits. And they will also they're supposed to address what we call in the industry both programs, that is SSDI, which DAC is a part of SSDI, and they will also check out SSI, Supplemental Security Income. So please, 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 please. Jen, I apologize, but do not see that my question was answered. If my wife is on SSDI and I lose my job with benefits, can she join Medicare? Yes. Even after 2 years after she first started collecting SSDI? Yeah. If, well, she can start benefits regardless, but if she had health insurance through your work and your employer had 20 more employees, then she can apply for Medicare. And there's no penalty because she had creditable coverage. Okay. So she can, if she doesn't have health insurance because you stopped working this month, then I would call and, she's already on Part A. They already signed her up for that, the hospitalization, but she probably refused Part B, which was the smart thing to do because she already had a health insurance from your work, but now she no longer does. So yeah, she needs to sign up for Part B. And she's, even after 2 years, she first started collecting the SSDI. So it sounds like if you get Medicare after being on disability for 2 years, so maybe this is her initial enrollment period. So the whole creditable coverage might not even be an issue. So, and then she also needs to find out, so she'll sign up for Part A, Part B, and then she needs to find a plan, a Medicare plan, either a Medicare supplement, which are the ones I always recommend, or a Medicare Advantage. I recommend looking at those first. And if it's not for you, then it's not for you. So, and then you can reach out to Chapter and they can give her some more direction on how to apply and all that kind of good stuff. And their help is 100% free. Age 65, always ask about Medicare supplement first. Yes, always, always, always. Doesn't mean you take it. It's everybody's different, but always check it out. There's a lot of Medicare insurance agents out there that want you to sign up for a Medicare Advantage because they make more money, and that insurance companies make more money. So that's but if a Medicare supplement is the best for you, then that's what you should get. If not, then you don't. Simple as that. All right, got another video question here.
My question today is, and I've been watching your website and your information to see if any of these things match my problem. But my husband was killed in a motorcycle accident very early when my children were 2 and 3. He was only 29 years old. But because I made more money and I worked, I wasn't entitled to any of his benefits. Only my 2 girls got children's benefits. I later called probably about a few months ago to ask if I was entitled, now that I am 64, to surviving spouse benefits. And they said, well, you made more money, so why would you need surviving spouse benefits? You would just get your disability, and that was it. I wasn't entitled to surviving spouse benefits, just my Social Security disability. I don't know if is there someplace I can look at or something that I can quote to them where it says that I can claim his benefits and my benefits, or is it just too late? The other thing I asked was, well,
Okay, let me answer this one first. Because you're receiving disability, then it sounds like you can collect surviving spouse benefits, but it's just going to offset what you're already receiving from disability. It sounds like, because your benefit amount is higher. So just confirm, because he passed away so early, they don't need the high 35 years and they index it differently. So if you just ask someone at the front desk, when you just walk in, that's a customer service representative. They're not specialists; they're generalists. Still the hardest working and the least paid employees at Social Security. So be nice to them. But you need to speak to a Title II CS, a Title II that specializes in this, and they'll run the numbers of how much his benefit amount is. But if his benefit amount that you can get is less than yours, then there is no use, because you're receiving disability. So if you're getting $1,500 from disability and you're entitled to $500 from him, then you'll get $500 for him, and then $1,000 from your own record. So for a total of 1,500. So it's not going to make any difference. If you were receiving retirement benefits, then everything changes. But you're receiving disability. So what they told you originally, and you are probably one of tens of thousands, of hundreds of thousands of people out there that, you know, are not getting the benefits they're eligible. In your case, because you're receiving disability, you are. But people that are on retirement benefits in your situation, yeah, they're making the wrong decisions sometimes because they're told, you know, decades earlier, years earlier, you can't get benefits. And the reason you couldn't get benefits is probably two things. Is because you were working over the annual earnings limit, so therefore you could, but your benefits would be withheld because you were making too much, or probably because you had children receiving benefits, and therefore there's a family max. So even if you were eligible for benefits on his record, it wouldn't be any more. It would just, you know, whatever amount it was, would be divided by 3 instead of 2. So you'd still get the total family amount. So that's probably, so that they were correct years ago when they told you that, sounds like. And now because you're on disability, then, but I would call and double check and say, hey, by the way, what's his PIA? Just tell me his PIA. And then if it's anything less than your benefit amount, then yeah, unfortunately, there's no more money there. So.
Did I ever get the death benefit? And she said, no, there is no record of you receiving a death benefit. And I said, well, can I claim it now? And she said, no, it's been past 10 years. So you're not able to get the death benefit. So like I said, I've worked probably for 34 years.
All right. So that's the that lump sum death payment, the $255. And you probably didn't get it. The children probably got it. So they should have. I've done this several times. It's crazy. Where you've got, you know, 3 or 4 or 5 children, and we set them up for the monthly benefits for surviving child benefits. And then if they're entitled to that lump sum, they don't each get $255. We take that $255 and divide it by 5. And yeah, it's crazy. So, but they probably got it. Yeah. So.
And just went on disability 4 years ago. And that was all I was entitled to. Nothing with my first husband who was killed in a motorcycle accident. Okay, thank you, Dr. Edweir. Have a blessed day.
All right. So I think we covered all her questions there. So, someone says they have to restart. Okay. Someone having a problem with whatever. All right. When to request an extension for son turning 18 in December, now or wait? Nowadays, I would get that process started. So basically what you're saying is you have a child under 18 and receiving child disability benefits. And what happens is it's called age 18 CDR. That the child is turning 18, and there's different criteria for disability for children versus adults. So if the adult has turned 18, then yes, then they need to do it. And it's usually automatic. It should be automatic. But if you want to get a head start, call the local office and say, hey, who does the age 18 CDRs? And then you can say, hey, you know, by the way, you know, address and phone number and everything's up to date. I've got my documents or whatever, and I got the names of the doctors and all this kind of stuff. And is there any way we can get a head start on this? And they'll tell you whether they can do it for you. Remember, the benefits stop at 18, but if the child is still in school, high school, it can continue until they graduate, or 19 and 2 months. So. But yeah, good keeping a heads up on that. My sister, 72, never had Medicare. Can she get it now in July? Never had Medicare. If she's receiving Social Security benefits, then she does have Part A, unless, well, she's getting Social Security benefits on her own record. Well, if she's getting Social Security benefits, then she got Part A. So there's very, very small percentage that don't, but that's because they never paid into Medicare part of it. But if she never had Medicare and she didn't have creditable coverage, then she can't get it now. She'll have to wait for the general enrollment period, which starts January and goes through March. So January, February, March. So if she doesn't have Part B right now, then she has to wait till January and sign up for Part B in January. It'll start in February 1st, but she'll be paying, 70% penalty perhaps? If she didn't have any credible coverage since she turned 65, then she just might have to pay that 70% penalty. So you can reach out to chapter, call Social Security, and find out what's going on and whether, hopefully she's had creditable coverage. So let's see. Dr. Ed read my question, but doesn't seem like knows it's a YouTube issue. Oh, okay. Some type of YouTube issue going on there. All right. So I'll buy the company later and we'll figure it out. I think it's owned by Google or something, is it? Yeah. Congress has the power to waive or delay the automatic Medicare cuts triggered by the PAYGO. How may believe they might? Yeah, they had the chance. It was actually in one of the earlier versions of the big, beautiful bill. It was in there that they were going to suspend the PAYGO, but then they took it out. They believe that's a beautiful thing. And what is the PAYGO for others than my regular viewers? It's basically the PAYGO is when this reconciliation bill, this kind of gets in the weeds. The one big beautiful bill is a reconciliation bill, and anytime anything like that causes a deficit, causes debt, then the PAYGO Act kicks in and it says, hey, you just racked up a whole bunch of debt. You need to find cuts somewhere else. Automatic. You have to. And who's you? The Office of Management and Budget, Russell Voigt, one of the authors of Project 2025. So he's loving this. So he can't touch Social Security. That's part of the PAYGO Act. He can't touch Social Security, can't touch Veterans Affairs, but Medicare is the next one, and he can do whatever he wants pretty much with Medicare. So Medicare cuts, we are looking at about $535 billion of Medicare cuts, automatic, and there is no suspension to the PAYGO. So a lot of, next year is going to be crazy for Medicare and Medicare Advantage and Part D prescription drug plans and all the rest of it. So you can reach out to chapter and tell them, hey, it's put me on the list for October. And if you're on a Medicare supplement plan, you can change that any time of the year. You might have to go through health underwriting, but if you're on a Medicare Advantage or a Part D prescription drug plan, you can't change it until October 15th, from October 15th to December 7th. And then whatever change happens January 1st. But the new plans come out October 1st. If you're moving or something like that, you can change those. If you recently gained Medicaid or lost Medicaid, and there's all kinds of other little strange exceptions there. So you can reach out to chapter there and they can help you out. Does Doc's voice sound a little different? Yeah. Does it sound different? Yeah, I got a little bit of a hoarse there. So do I still have to pay taxes on my Social Security check, or did that go away? No, it did not go away. So there is a deduction if you're making a bunch of money, but it doesn't affect your Social Security benefits if you're one of the lower 50% of Americans who just receive pretty much Social Security and very little else. Then it doesn't help you. So it never was going to help you. So there's that. So all right, let me see if I can find. We're at their see if I can find some new people here. One, my mom is in a home and she gets her Social Security benefits to her bank. I would like to change her benefits every month to be used deposited in my bank because she is in a nursing home. Yeah, you can do that. I would recommend having Social Security assign you as the representative payee. But if you're in a nursing home, do they get the checks directly? And sometimes nursing homes do that they want those checks directly so they can, pay for everything. But if not, you can apply for what's called a representative payee. So you become her representative. So if anything happens, you need to change your address, find out what's happened, a check or something like that, then you can be that person. And as part of the representative payee, you can change her direct deposit to whatever account, but you have to make sure it goes for her welfare, obviously. And then in terms of the mechanics of it, You just have to notify your bank that it's, you know, a check is going to be deposited. It's in her name, but it's going to go in your account. Sometimes they'll stop it because they don't recognize the name. If you do the representative payee, it'll say Juan Martinez for Mrs. Martinez, right? So it'll have two names on there. Let's see. Can working during the app process affect the non-medical review, or will it be considered a failed attempt to return to work? It really depends how much work we're talking about. There's things called unsuccessful work attempts, where if you go ahead and apply and then you just, you know, hey, I'm going to give it one more I'm going to give it one more shot to see if I'm able to work. And if you're able to work and make over substantial gainful activity, over the 1620 per month, then you're good. But if not, you just notify Social Security and say, hey, I've got a UWA. I tried, I did it for a month and it just took a toll on me and I couldn't continue, but I tried. So yes, that's not an issue. All right. My adult son has SSDI, lives in a group home. Is Trump cutting their benefits? SSDI, no, there is nothing on the plans other than the impending cuts that are going to be happening here in a few years. But there's nothing in terms of SSDI. I know during the last Trump administration, that was one of the main focus is getting FOCI, was increasing CDRs, those continuing disability reviews, to get more people to get off the program, but that hasn't started yet. But if he's in a group home, then Medicaid. And yeah, Medicaid is going under massive cuts. So states are starting now to start cutting Medicaid because Medicaid and SNAP, the food stamps, are administered by states. It's a federal and state program. And even though the federal government, they decided it's a beautiful thing to delay paying until after the election so they can stay in office, states have to balance their budget. Most states have to balance their budget, and most states look to the future a year, 2 years ahead, and they say, okay, well, here's how much money is not going to come in next year and the year after, so therefore we need to do this now. And that's what they're looking to do. I see all kinds of reports. So I'm working on a program right now, a platform, a community that, yeah, we're going to address that. So, all right, we are, I think my doc took me off disability after 6 months, and I'm still unemployed. Yeah, a doctor can't do anything like that in terms of Social Security. I mean, yeah, doctors all the time say, this person is disabled, and people take it down to Social Security and they say, okay, hey, doctor says I'm disabled, so give me my disability benefits. No, yeah, it doesn't work that way. Because some doctors, you know, will say anything anyway. But they'll take that into consideration and they'll do whatever and look at all your other doctors and may send you to a consultative exam. So one doctor doesn't, you know, make or break you necessarily. So, all right, we are pretty much out of time there. I will be back again tomorrow and we'll talk about another topic and answer a whole bunch of other questions. Y'all take care. Have a beautiful night and take care of each other. Bye-bye.